Thank you, Mr. Chairman. Thank you for the discussion that we're having today, and thank you all for your patience in responding to each one of the members who have presented questions and issues and discussion with you today. I hear the discussion and I hear two words, care and cost, right? Those are the things that you all are trying to balance. I understand that one of the things that we as members seem to be focused more on is the cost. And I get that. Mr. Cordani, I know that you said that you have been with Cigna for over 30 years, and you've seen some dramatic changes in the industry and healthcare during that time, and one of those that you point to is cost and how much that has risen dramatically. Not just since the Affordable Care Act was passed. You know, they all love to use the word Obamacare. I don't know why Obama has to be attached to it. That becomes like a dirty word in so many ways, but the Affordable Care Act. And since 2000, the cost of hospital stay has increased, you said. Is that correct?
Congresswoman, yes, that's what I noted. Since 2000, the cost of a hospital stay is up over 200%.
And what do you attribute that to?
If you look at the cost structure in America, we essentially have inflation on the same goods year over year for healthcare costs that are greater than any other good in America. So there's wage inflation, which we know, and we saw a pronounced effect of that during COVID, necessary wage inflation that took place. We have site of care reimbursement that is in the design of the ecosystem. So we will pay more for an MRI in a hospital. It could be the same GE equipment in a freestanding facility at half the cost, and it could be the same GE equipment in another facility, yet half that cost. So we pay higher in site of care.
Thank you. Thank you. And I understand, Mr. Hemsley, you discussed that in your testimony when you discussed hospital pricing. You actually have a graph that is very much situated, as Mr. Cordani says, where you do the overall inflation and then you compare it to other components as well. Is that an area that you're looking at also? It is. And, you know, the reason I'm bringing this up is, and I know that there's been some concern about the Affordable Care Act and what it means and how this is a terrible thing and what costs are. I always explain to my colleagues, or try to use myself as an example, that I'm here representing the Virgin Islands. And in the Virgin Islands, we don't have all of the full use of the Affordable Care Act. We do not have an exchange. Ms. Young, you talked about what has happened to you and the premiums that you have to utilize. What would happen if you did not have an exchange to get your health insurance from?
If I did not have an exchange with the rates that they are now, I would probably have to go without.
You would have to go without health care.
Probably.
So in the Virgin Islands, 1/3 of the people living in the Virgin Islands do not have health care because we don't have an exchange. People who live in Puerto Rico, 3 million Americans, many of them do not have an exchange. In the Virgin Islands, 1/4 of the individuals rely on Medicaid, another 1/4 depend on Medicare. And with the HR 1 and the nearly $1 trillion in cuts that will eliminate coverage for at least 15 million Americans, many of them will be affected by that, increasing the amount of individuals that do not have care at all. Now, I'm going to disclose, I previously worked for United Health, worked in their AmeriChoice division, where at the time we employed a philosophy that put value and care at the forefront. One of the things in the Virgin Islands we're concerned with is all of the uncompensated care and what's that going to do in rising our hospital costs there. Mr. Hemsley, you are at United Health Group now. Can you speak about the financial viability of value-based care models and what's that like in practice? And are you utilizing that model still today?
Yes, we are, Congresswoman, and as I said previously, when those have been in place for a few years, you do see a change in the health status of the people that you're serving, and it improves, and you're able
How do you practically utilize a value-based care model?
to incent the physicians and the entire system to care for individuals in the right place, at the right time, more preventative care, making sure that they use specialists when they need them, making sure that they get their drugs, that they're adherent to them. And so you actually are very engaged in terms of making sure that they're cared for in all the right settings. And when you do that and do it on a consistent basis, you see that you're using the resources of the system more virtuously. You see that their cost trends tend to down, but their health increases. And that is something that I think is, when we talk just about cost, the actual quality of their life improves because they are not in some unfavorable cycle or as concerned. They know that they have a medical home and that there is someone caring for them. They have a resource. They can get information. The group is already informed about them. They're connected, and it is by far, I think, a more virtuous model.
Thank you.
And if we could do that at scale, it would be impactful.
Thank you, Mr. Chair. Thank you for your indulgence. I just propose that we, I hear the discussion about cost, we need to talk about care. And we as members of Congress need to begin that discussion. Not about government taking over health insurance, but how do we work with healthcare providers? How do we work with these companies to ensure that all Americans have the care they need so that we can be a healthy nation, which in effect is financially a better place for us to be? I yield back.
Mr. Kerry.
Thank you, Mr. Chairman. I want to thank all the witnesses for being here. Ms. Young, I definitely appreciate you being here.